Hello, everyone. I'm here with Dylan Lockwood, online content editor with Zpryme. Dylan, thanks for joining us today. How are you doing?
I'm doing pretty good, all things considered, Jason. How about yourself?
Oh, doing well. Got the Batman shirt on and stuff, so feeling kind of good
You
today.
got the Batman shirt on?
Yep, had to bust it out. Little
Oh,
little little
nice.
change up there, and yeah, really excited to have you on. For all those who don't know, Dylan is located in Spokane, Washington, and he's been following both personally and then from a business perspective too, with regard to the utility industry, what's going on and the impacts of the COVID-19 outbreak. So we brought him on today to really share his perspective of what's going on in the Northwest there, and I think really excited to share that with our audience. So Dylan, I'll just jump right into it. What are you seeing from some of the Northwest utilities and how they're responding to the outbreak? And any specific examples you can share would definitely be welcome as well.
Yeah, sure. Although, first off, as you can as you can maybe hear, there's construction going on upstairs in my neighbor. There's a lot of noise going on in my apartment building these days, just because everyone's home. The kid runs a little bit restless. The other thing is my cat just jumped in my lap right as we started recording. So this is Alistair,
Hey,
everyone.
hey, Alistair.
He might be joining this video for a second. Although I can although I can kick him out if you need me to, Jason.
No, it's fine. We can have
Um,
little guest appearances. That's fine.
so as for utilities, one thing I did is the thing I noticed first was that Avista got ahead of the story a little bit before most of the rest of Spokane did. Like, we hadn't even instituted social distancing yet, and Avista was already doing a work from home policy for everyone except truck drivers, basically. So, uh, like executive staff, customer
Mm-hmm.
service representatives, all of them have been doing work from home for quite a while now. I almost worry, like, what does Avista know that the rest of us don't? And then,
Yeah.
sure enough, that weekend is when like all the school closures were announced and stuff.
Oh wow.
Um, so there's been, like, every utility in Washington has put out a statement, generally something to the effect of, uh, if you're having trouble paying your bills, we can set up these payment plans for you. We're not going to turn off your power, et cetera, et cetera. A couple of them have gone a little bit beyond that, offering different other kinds of resources. Seattle City Light has their project share, which is something they normally do, uh, which is these drives to help people pay their power bills who have a harder time doing it, and now they've uh, been stepping that up. Avista has also been involved. They have a more comprehensive list on their website, at least, than most of the others will do, in that they explain exactly what's going on, like what they're focusing on. I think that's been helpful, that they're outlining sort of where their priorities are going to be for the time being, so you can kind of figure out what that means for you. Like, they talk about that we're still going to be sending out emergency workers for emergency cases, but we probably won't be sending out as many people to check meters for those who opted out uh, of the smart meter program. Almost all of them are going to be working remotely by the 24th. They're yeah they're just focusing on what's time sensitive and that sort of thing.
Oh wow. Yeah, yeah. That's a lot, and yeah, it's really insightful to know how early they were to kind of see this coming. When I think a lot of what the normal population has just kind of felt the true impact over the past week or two, yeah, from a national level. So thank you for sharing that. And
Yeah, I mean, the thing is that, like, with Washington, with Washington in particular, I know it's been a focal point. I know there was that weird New York Times headline this past week that had this really weird horse racy vibe to it, where they're just like, New York is now the center of New York City is now the center of COVID-19 watch in the U.S. or something like that. It was a really weird title, but Washington has a ton of reported cases. We've had more deaths here than in most other places in the country, and I think part of the reason I've been so, some would say, unhealthily uh, devoting energy to a ton of energy into keeping up to date is because information's coming in like very piecemeal
Mm-hmm.
and from different sources that um, it's I think the utilities that have gotten out ahead of everything and laid out the important information about what it means for your bills and whatnot. I think that's been really helpful for people trying to make heads or tails of what's going on out here.
Yeah,
I'll get out of here.
Alistair. Yeah, I think that's something that we've talked about both internally here, and I think most people are talking about with their families, is that it's hard to get good information, and I think that's part of why we know why we're doing this, and I think why Zpryme is going to continue to watch some of the information coming out there, and so I appreciate you kind of explaining some of that to those listening. So, in specific to Seattle, because you are so close to what you, as you mentioned, like the epicenter where this all started, right, and where before anyone was aware of this. So, what is the state of things there today? And can you talk about maybe how what are officials doing, how the people coping, and any positive stories to share?
Yeah, sure. So Seattle was, probably the first place in Washington that got hit really hard. There in a town called Kirkland, which is where all those Costco goods come from, or at the very least where they're warehoused. Um, but yeah, so Seattle, I mean, I haven't been there since the outbreak for obvious reasons, but I've got a lot of friends out there, and there's a lot of media coming out from there, and it's really strange. The main downtown area, all the popular hubs of people are entirely dead. Like you can see those photo albums of people taking shots of empty streets of Seattle, which is if you've ever been to downtown Seattle during the day or the early evening, you would realize how absurd that is.
Mm-hmm.
Um, but what's been interesting to hear is that while major thoroughfares and general gathering hubs are shut down, people are people are need to get out, like, and in somewhere like Spokane, where we're really spread out, we've got about 250,000 people that live here. You can go out, you can walk for a while, do what you need to do. It's a little bit harder in Seattle, um, just because, I mean, if you're trying to avoid those downtown areas because that's where all the gatherings are supposed to be, and then you head out to a place like Green Lake, which is this, it's still in Seattle, but it's this kind of suburban area with this big lake and this huge public park, and everyone's kind of going around there taking their strollers there, and then that actually kind of ends up counteracting the uh, the social distancing. But and all my friends have been telling me that it's been really weird with their living situations, because almost all of them, because no one can afford to live in Seattle, they're all sharing, they all have roommates,
Mm-hmm.
and then they had to work out a plan with their roommates for how they were going to handle the distancing. Like, they're obviously going to be together that whole time, which means that they have to be responsible for each other and what they're doing, what they're going out and doing, who they're in contact with, making sure to keep those total number of contacts in the house to a minimum. um I'm gonna read a quote from one of my friends in Seattle.
Yeah.
She sent this to me. She said, "This all spiraled in like 2 weeks. 2 weeks ago, we thought it was crazy to ask people to limit hanging out as long as they were working from home. But now roommates are agreeing not to see anybody else, or they form closed groups. So like 20% to 100% really quickly. I've seen a major attitude shift from "we'll be okay, I'm not worried" to "we need to all take this extremely seriously and protect everybody else," which is good. So yeah, I guess for Seattle specifically, it seems like they're adapted. They're adapting,
Okay.
which is very different from I think the push pull that's been here in Spokane.
Hmm. Yeah. So if I read into that quote from your friend, maybe you could expand it. It sounded like, even though there's like a realization of that this is a hard time, that they all realize that they need to band together to pull through it, and that's what everyone needs to do to step forward. Does that sound right?
Yeah, I would. Yeah, I think Seattle has always kind of had that us versus the world mentality.
Mm-hmm.
Um, Especially because it used to be counted out as one of the big cities. Our sports teams are always inherently crappy, except for the Seahawks for like a very short period, and the Sonics for a even shorter period. But yeah, so I think that is kind of how it's going. That when it started and the information was kind of trickling in, then yeah, maybe it wasn't as taken as seriously as it needed to at the time, but that's not really their fault.
Mm-hmm.
But then once it became clear, and it became clear very fast in Seattle that it needed to be taken seriously, it does seem like people are banding together at the right times.
Yeah, yeah, and I could definitely understand like even the difference in Spokane and view and understanding of it. I mean, just being in Texas here, people here, I think definitely do not have this sense of urgency and let's get this done no matter what, that versus
Mm-hmm.
probably people there in Seattle or folks in New York. I think just hearing, if you're just watching the news and you look at the tone of the New York governor versus other governors, you're not getting that. Not even from California, who really has a lot of those measures in place. So it's really, the closer you are to that, I think the more you feel it, but it also creates a more sense of we're in this positive notion towards taking these steps are the right thing to do, and
Yeah,
that's good to hear.
yeah, you're right. Each governor does have their own tact about doing this. Jay Inslee in particular has been like super stern and
Yeah.
got that air that he's trying to be the man, which is just this is an entire sidebar. It's just kind of a weird look for him because he's always been a really sort of happy-go-lucky kind of guy who just wants to talk about climate change, but
Mm-hmm.
now he's got to step up and lead. And I
Yeah.
mean, the results have been mixed, but at the very least he's been decisive, and I kind of appreciate that. But what you said there that was actually substantive, that I thought was interesting, is how we talk about this, and by we I guess I mean how sort of the media talks about it, and I don't just mean the media in the sense what everyone means, which is cable news
Mm-hmm.
and national publications. It's more than that, like things like podcasts, things like these little short video things. I've noticed that there's sort of a propensity to talk about it in sort of hushed tones. I don't think either of us have said coronavirus or COVID-19
Yeah.
since you said it at the very beginning.
Yeah.
And you just refer to it as it or a crisis, because I think our I don't know what her title is right now. Our head of HR, Emma Garcia, she posted an article today saying that like this just like deep there's just this kind of like weariness and sort of depression that comes along with this sort of thing, and it's not just cabin fever, it's like an actual sense of grief, because there's a lot of ourselves, a lot of our culture that's just sort of, if not lost, at least put on hold for
Mm-hmm.
a while. And I think because of that, it makes sort of talking about this in a really it makes talking about it really hard
Mm-hmm.
without either getting really solemn or getting really flippant, if
Yeah.
that makes sense. So I think one thing that's sort of helped uh, with with us in Washington helping adjust is that because a silver lining, because a lot of the official information we've been getting has been conflicting and slow. We're informing each other, and a lot of the way we hear about these sorts of things, the way we hear about important information is from our friends and family and neighbors. And
Yeah.
when we're getting it through that lens, it's a lot easier to have those kinds of conversations and figure out what exactly needs to be done.
Okay. Yeah. Yeah. I think that makes a lot of sense here. Um, I did want to follow up quickly because I know you did talk about this a little bit, but with regard to Avista, anything you're, they've been very good about communicating to their customers. Um, Anything else you're seeing there, or any of the other programs you wanted to highlight in terms of what they're doing?
Um, I know they do have they do have the they do have the Avista Foundation, which is a lot like the Seattle City Light program I talked about earlier,
Mm-hmm.
but I'm not actually sure what they've ramped up in regards to. No, sorry. Here's a story from the spokesman review right here. They just gave $568,000 uh, for, in grants. 184,000 of which is going to various nonprofits that are helping deal with the effects of the COVID-19 pandemic. The foundation put 40,000 toward the restaurant and hospitality
Oh
community.
wow.
Uh, so Avista is investing money in getting this and getting money out there, directing people towards where they can put money. So they're doing that.
Yeah.
That would be the program of theirs that I think was best to look into right now, unless of course you need help getting your bills paid, in which case I would call them directly.
Yeah. And did they did? Do you know if they did suspend shutoffs?
They did.
Okay.
I think the governor made all of the utilities. There was an announcement, I believe, last week that he made that no one that they I believe they suspend shutoffs. I think all the utilities do.
Okay.
At the very
Yeah.
least, all the press releases I've seen from the utilities have said that they're going to.
Got it. Thank you. And and sort of you talk that's a significant investment there, and I think that's where a lot of the concern is that outside of the virus getting sick and your loved ones being impacted, right behind that is the economic impact. So is that one of the biggest concerns you're there, not just in Washington or maybe for the region? How is this impacting small business, education, which I think you have some thoughts on, and then maybe the healthcare, or any idea of how that the hospitals and healthcare workers are coping with this?
Yeah, there's. I mean, I've been reaching out to people all since this all started, asking about their stories, how they're adjusting, and some people have it better than others. I mean, I'm incredibly fortunate that I live the work from home life every day. So even I mean, like there have still been adjustments, like my building being more active, and the fact that I can't visit my friends, go out and do all the stuff that I do to normally get away from this place that I'm working in,
Mm-hmm.
and also sleeping in, and also eating in. So I That's how it's been for me. But for other people, the transitions have been mixed to difficult. There are a lot of people who are home without their jobs. I know a lot of my friends who are not just teachers but substitute teachers are really in a precarious place right now.
Mm-hmm.
There was a the I think the teachers union had a big fight to get them money when they were immediately sent home, and I believe they got that money, but I don't believe it's a recurring stipend. So I think they're probably gonna have to like get that temporary unemployment, and then when everything comes back, like things might be up in the air for those who aren't like necessarily working at the primary schools but are working at some of the other areas. As for small businesses, yeah, it is hard on a lot of them. Thankfully, when it comes to small businesses in Spokane, I don't want to be too generalizing here because I might get in trouble, but a lot of the small businesses just are like retail stores and restaurants.
Mm-hmm.
And a lot of the restaurants are still doing takeout, even some of the sit down ones, because they're working out these systems. And there's been a real push in the community to like make sure that to buy local, basically, to keep these businesses going on. I've seen social media posts of people just posting their lunch and where they got it from, just because they want to, they're part, because they're also part of that community. They want those businesses afloat so that they can have those jobs when those jobs come back. I think the retail workers have been I think the workers have been hit the hardest,
Mm-hmm.
because they don't know if their jobs are still going to be there when they come back. As for other things, we've got, things like, I have a friend who works in finance, and he's said that like events companies are having a hard time. Another friend of mine who works in banking says that there actually are small businesses that are coming in, like looking to make sure that they're financially set for the crisis. They're asking for advice. But some of it is also just kind of business as normal, because they're trying to figure out how to transition to a
Mm-hmm.
more online based kind of thing. So I would say it's a mixed bag. If you're in a position to be able to transform your business, I think that it's sort of that those businesses are doing fine. But when it comes to the workers, the people that are in the shops, they're really worried.
Yeah.
Especially the ones in the shops that are still open. The grocery stores um, are all slammed, and they're just full of people, and everyone's handling cash.
Mm-hmm.
And I have a friend who's a manager at one of the co-ops, and he's constantly understaffed, because workers are afraid to come in, and they've got a lot of restrictions in place. He pitched an idea where they would cover the
Mm-hmm.
floors in 6 by 6 squares and have a
Whoa.
one customer per square policy, which I thought was funny. This is not necessarily applicable to the entire United States, but the marijuana shops are still going to be open. They've been deemed an essential business, for because I mean, for a lot of people that's a prescribed medication. But they're also getting they're also getting swarmed by, as my friend put it. Uh, she says, "I wish my shop would go to medical only, because I don't think it's fair that some people use it as a medicine and other people are like, I need 100 edibles so I can get big ripped in quarantine, lol." So it's a strangely unique problem that I find very interesting.
Oh yeah.
But to get to your point about healthcare workers, I had a nurse who contacted me, and I'm just going to read her response straight out, because I think it's very uh, very important here. She says, she is a nurse. "I still have to go to work like normal. The information that we receive from the hospital is vastly different from what's portrayed in the media, so it's really confusing to navigate the latest recommendations and know how to protect myself and my patients. It's a really scary time to go to work."
Well.
The absolute scariest part of this for healthcare workers is the lack of proper PPE, which I believe stands for um, personal protective equipment. Yes, sorry. I took an OSHA class way back when. Initially, hospitals were telling staff to reuse surgical masks to help conserve the stock. At my hospital, we are issued one surgical mask and expected to carry it around in a paper bag and use it over and over until it becomes visibly soiled. There are so many problems with this. Imagine using the same. Okay, I can't really say that. That's not appropriate, but
Yeah.
but like she likened it to birth control. I'll just put it that way.
Yeah.
But where you're not supposed to reuse that either, because it becomes less effective.
Mm-hmm.
It's a gross but apt analogy. Reusing masks between patients across multiple shifts in and out of a bag is just as gross and problematic. The hospital says it's fine. The media and science say it's not. Local news stations and hospital Facebook pages in the area have been asking for volunteers to sew masks for us, some offering kits with medical grade filtration inserts, but not all.
Hmm.
My hospital has stood firm that homemade masks are not allowed. They cannot ensure proper protection because small particles like a virus can get through and around fabric masks, in addition to the problems I already listed about reuse. But why are homemade masks good enough for one of Washington's largest hospital systems and not the other? If we are truly going to run out of masks in a few days, according to the latest update from my hospital's emails, is my hospital doing enough to ensure we have personal protective equipment when it's doing the exact opposite of others in the area? It's a well-known fact that respirators and N95 masks are the best, but they are in short supply. Surgical masks are kind of okay, but we will run out of them very quickly. The jury is still out on homemade masks, and the CDC released a statement a few days ago saying that if we run out of masks, nurses can just wear a bandana on their face, in all caps, because that's insane. So we would never send a firefighter into a burning building without his gear, or send a soldier to the battlefield without a weapon, despite good science and living in the richest country in the world. If you work in healthcare, it's the wild, wild west now, and we are disposable because this is what we signed up for. And that's really, really pessimistic. But I think, I think that's a feeling felt by a lot of people. It was so fascinating to me when she first said what's being said in the hospitals is different than what's being said in the media. I assumed that they were getting better information, but
Mm-hmm.
they're actually getting worse information in the hospitals. And again, this might just be Washington. I don't know how it is across the country, but um, it really it really really makes you pessimistic when you're hearing that things might open up in the next couple of weeks, and yet you know we don't, not only do we not have proper testing, we don't even have proper care for our medical workers. So if they start like getting infected and then they have to go home, then what happens?
Mm-hmm.
Uh, so I think that just falls into a consistent theme in almost every person I've talked to, whether or not they're adjusting to work from home, which is that in Washington State there is a lack of credible information that, other than just the stay the stay home national media stuff,
Mm-hmm.
are I, whether like there are resources out there and they have been important statements, but there is a growing sense that our local leadership has really dropped the ball. And I don't just mean the mayors, the governor's office, and our national representatives, although all of them have had their problems as well, but also our the hospital, you know, the hospitals, and uh, just local business leaders, because they're they're making decisions with the limited information, and then that kind of trickles down.